Welcome to All Access, where we meet at the intersection of healthcare and generic and biosimilar medications. Brought to you by the Association for Accessible Medicines, representing the generics and biosimilars industry. Welcome to All Access. I'm Dan Leonard. A few weeks ago, when we were preparing for today's podcast, we were all set to start off with some amazing facts about the organization that we're featuring today, Direct Relief. Here's just a few of the statistics from last year, 2021. In 2021, 26,616 shipments of medical supplies and medicines, 4,140 tons of medicine and healthcare supplies to healthcare providers in 97 countries, all 50 states and 6 U.S. territories. Also, 239 million defined daily doses of cancer and diabetes drugs, antibiotics, and rare disease treatments, totaling over $1.66 billion in value of these medicines and healthcare products, but all delivered free of charge to folks in need all around the world. Amazing numbers, don't you agree? Well, that, as I said, was how we planned to start today's podcast. But on Thursday, February 24th of this year, Russia invaded the Ukraine. And within hours, despite reports from Direct Relief staff in Europe that had to travel to Ukraine, that it had been suspended, that travel had been suspended, Direct Relief announced that it was immediately expanding humanitarian support in Ukraine and to aid not only those in Ukraine, but also tens of thousands, now close to millions of people who are fleeing Ukraine for other border countries. So obviously a global tragedy, before our eyes that is taking place in Ukraine. So Direct Relief already had shipped $26 million in medical aid to Ukraine, but now obviously more is needed. So the day following the invasion, Direct Relief committed another $500,000 to support health efforts in that country and surrounding countries absorbing refugees and fleeing violence. So they've shipped additional IV fluids, antibiotics, medications, and other products that are on their way or have already arrived in Ukraine. So I could go on and tell more about this story, but why not hear it from the leader of the organization, who's our guest today. And I'm very pleased to be joined by our very special guest, Direct Relief President and CEO, Mr. Thomas Tighe. Thomas, welcome, and thank you for everything that you're doing.
Thanks so much, Dan. My pleasure to be here. And hey to all the AAM members, really appreciate all that you do and on an ongoing basis, and really just a privilege for me to be here.
Right back at you. So let's start where the world is watching right now, and that's the Ukraine. And I'm sure this is top of mind for you. But are any of your people, any of your staff or volunteers from the Direct Relief team, are they in the Ukraine now?
Our resident staff member is in Poland. So she's been coordinating kind of, that's where a lot of the external aid is flowing through at the border. And we had, as you mentioned, it had an ongoing channel of support to Ukraine for several years. Actually, most recently, the $27 million in aid were in the prior 6 months before the war started. And even 3 days before the war broke out on the 24th, we had a recent delivery of really kind of niche drug for oncology treatment and cardiovascular treatment. So that was the support over the past 6 months had been for the monoclonal antibody therapies. It was a relatively low vaccination rate in Ukraine. The government wanted, and we were able to obtain the monoclonal antibody therapy. So that was a big deal. And I think it worked through the Ministry of Health. And actually the Office of the First Lady was involved in that too. So we felt, when the war broke out, there was an existing channel. We knew how to get the approvals. As particularly your members would know, I think you can't just ship drugs. I mean, you have to be authorized. It has to be in a controlled distribution channel. Direct Relief is accredited as a pharmacy wholesaler in the U.S. with by the National Association of Boards of Pharmacy, and we happen to have an accredited EU accredited distribution center in Netherlands with cold chain capability. So I think all those pieces we are trying to bring to bear ever since the war broke out, just recognizing, that this is an unfolding, it's something we should be, it feels like something we'd be looking at in our black and white pictures in a history book in high school. This is, it's, we've kind of seen this and before, but I think it caught us all as a world a bit flat-footed to think that in this post-modernist, technology-driven age, this doesn't happen, and here it goes. So I think for context, Dan, if it's okay, I think, for your members too, I think, we're relatively accustomed to the natural disaster scenario where you have typically concurrently a spike in demand, a contraction in capacity is hospitals get damaged to treat the demand. And you have compromised or restricted supply chains, right? If a hurricane takes out these things. So those three combination, increased immediate demand combined with a decrease in capacity, because hospitals or whatever get damaged, and then a restriction in the supply chain, that happens all the time. This situation, you're having a spike in demand caused by just people, the mass evacuation, but also now the civilian targeting. So there's thousands of people who've been injured and killed, and an intentional targeting that's contracting the capacity of the health system to treat both what was existed before and what's been caused since the war broke out. And then again, an active targeting of the supply line. So it's a extremely dangerous, high degree of difficulty just for the making sure that people who need access to their medications, we can achieve that. But it's, it's so dynamic. It's in rapid flux, getting worse.
Horrific video coming back to us in this country from hospitals, maternity wards. Terrible. I'm wondering if the type of drugs and the type of equipment, the type of relief supplies that you typically would be sending to Ukraine have now shifted to more emergency kind of wartime products. Have you seen that?
Yeah, exactly what you said. I think our default was, mass evacuations in and of themselves are, they present certain risks for people who have chronic conditions. So what we see a lot in any mass evacuation, California, in the US for sure, is that as people who are managing their chronic condition well get disconnected from their care, that is who ends up in the hospital. Right. Routinely. It doesn't matter if it's a fire, a hurricane, or some other big displacement event, because asthma that's unmanaged, diabetes that's unmanaged, and hypertension that's unmanaged. Those three things put a lot of people in the hospital, and it happens all the time. So that was where we started, and the Ukrainian Ministry of Health started. They recognized that, all these people on the move. About 5 or 6 days in, it completely shifted. Where it was acute care, trauma, surgical, wound care, and everything related to that. It just that they were moving people who were in ICU beds for COVID therapy out so they could take care of the war injured. So just as you described, I think that the change, the shift came sharply and urgently. And so we've been able to kind of, we have these things like this medical.
Yeah, tell us about that behind you. What you use that in theater, if you will?
It was developed in really to support medical reserve corps members in the US, because each county is supposed to have a volunteer cadre of people who can deploy. They just didn't have a standard medical kit. So we spent a couple of years with the state of California and the different counties, what would be helpful so you could go out and treat in these emergency events. So it was approved as the state of California model. The Surgeon General approved it for use in the US. That as when the circumstances turned, we had several hundred of those kits, and the Ukrainians looked at the content list, and we showed a little show and tell about what it does. They wanted all of them. So I think those were sent in the first week. The first thing we sent was 360, sent another 108, but those have been, through Poland into bonded truck to the border of Ukraine, picked up and distributed by the Ministry of Health of Ukraine, and in use in Lviv, Kyiv, Kharkiv, and and they, it's what they're for. And we're now kind of in a constant effort of really trying to see where things are going, mobilize the resources both in Europe and in the States. And we also had the kind of interesting, unusual situation where some of the companies that actually had distribution centers in Ukraine have made their inventories available. So we're managing that inventory virtually, connecting that and arranging local pickup and distribution. So that's, worked surprisingly well given the circumstances, but it's still unfolding. And that ripple effect in the surrounding countries is, I spoke to the Minister of Health yesterday in Moldova. We have other calls arranged this week for all the ministers, with all the ministers themselves of health in all the bordering countries. And they're extending enormous graciousness to welcome, fleeing refugees, but it's, going to be a big stretch, and already is, for people with diabetes, asthma, hypertension, and also those, as you mentioned, just gave birth, about to deliver, as well as people undergoing cancer therapy now. I mean, just the range of complexity.
Well, the chronic conditions don't stop when the war begins. Those people still need to be taken care of. There's been a fair amount in the news around the need for insulin in country there. Is that something that you're able to provide?
Yes, we have an ongoing program working with two of the larger, with both Novo Nordisk and with Lilly. Where on an ongoing basis, we provide charitable insulin, typically for children and young adults with type 1 diabetes. So that's in about 40 countries. We have large scale capacity accredited cold chain storage here in California, also in Netherlands. And we've secured and identified a commercial operation in Poland that we can move stuff to and through to get to Ukraine. So in connection with the World Health Organization, we're having weekly calls with their NCD lead because that, is predictable, right? I mean, if people have that condition become unmanaged, particularly type 1, it's an acute crisis. So that is something that, fortunately we're set up to do on a charitable basis, but it's just a growing challenge. And the adjustment from, basically ongoing commercial status quo to interruption of commerce, then governments trying to step in, or WHO, that's always a clunky handoff. But I think the fact that the war is in Europe, Western Europe is functioning well and is so advanced, that at least there's a huge opportunity to do it well. This is not South Sudan, it is not Jordan, it is not Yemen or Eritrea. There's so much capacity there. So we should be able to, despite the challenge, I think the resources and know-how available in Europe is a really good thing to have.
So you mentioning those countries reminds me, and should remind all of us, that yes, the focus on today is on Ukraine, but your activities in the rest of the world do not slow down.
It's just there's always a chronic gap. I mean, the US is the richest country in the history of the world, and there are significant gaps in the United States. So we do a lot there. We work with community health centers, nonprofit groups, because it's just, there are gaps everywhere. Perhaps not Denmark, or, there's some European countries where it seems perfect, high tax rate, but, the social safety net is good. But I think a lot of places just aren't attractive from a business perspective. There's not enough money in the economy to warrant the investment for a drug company, for example, not only the manufacture, distribution, but also the per formulation registration. By the time you get there, given the size of the market, it's not a great business decision. It's still a good human decision, and I think that's what your members have been recognized and done. I mean, they recognize that, business, you have to make those calculations and make good business decisions, but it's also many of you and members are in just a great position of know-how of the human element that isn't a great business decision for a private company, but it's really important if governments or nonprofits are doing the activity to do it with the information that's based on the knowledge that now exists. And I think that's really, to you, Dan, and to all your members, the product contributions that Teva and Apotex and Adjunta have recently made and do on an ongoing basis, and others, exposure for people who work in a non-commercial thing to the thought process and just the practical realities is enormously valuable. I mean, we are trying to emulate, basically directly if it's government-like in purpose because we exist for the public benefit, but we aspire to be business-like in our practices because it works. I mean, it advances all the time, and your members, the whole industry is a testament to that. So that's why I was really thrilled that you invited me to chat with you today.
What are some of the other logistics challenges that you face?
Yeah, I think the wartime scenario is obviously it's heightened risk, and the main roads have been bombed. I think in Ukraine specifically, there's the government channel, which is actually the best functioning supply chain right now, but it's not great. I mean, we've been asked to deal directly with the city of Kharkiv, for example, and their medical department. And the National Ministry of Health will assist with some, as best they can. So there are firms that can and will contract to go into Ukraine. There's a heightened risk. Again, for us, it's not just shipping food or clothing, I mean, which is essential as well, but in a controlled way with tight inventory controls, which we don't relax in, even though it's an emergency. We're accredited and trained. We really can't do that. But the logistics, I think, in Ukraine are obviously compromised by war, power availability for things like cold chain. But as we make plans in Moldova and some of the surrounding areas, I think we will likely have the hub in Poland or Germany, and as we do in Netherlands, and then the distribution spoke to the countries. We're trying to arrange that in each of the countries in anticipation that they're going to need help, because I think you mentioned, we've talked about off camera, we're not through with COVID yet either.
Yeah, I was going to go there next.
So I think the ripple effects of a shock to the absorptive capacity of a country is limited. I mean, things are at their status quo, and in a place like Moldova, the status quo wasn't even meeting all the needs, basic needs for chronic care, things like insulin. COVID chewed up a lot of the world's resources, and the public health departments are coming out of COVID, I think, in a weakened state, not a stronger state, despite all the spending, because a lot of it went to very high priced PPE. It chewed up national budgets to an extraordinary degree. So I think it's sobering. Again, it's Europe, though. I think the fiscal strength of many of the countries is a good thing to have, but I think the combination of this war happening against the backdrop of the worst pandemic in 100 years, some of Ukraine's specific infectious disease issues, including low vaccination rates, relatively high case rates, and hospitalization rates when the war started. And I think probably your members are aware, there's a multi-drug resistant TB in Ukraine. I mean, that's where Doctors Without Borders has been focused on for years. And a relatively, there's concerns about HIV as people have to flee, and maintaining those infectious diseases under control. And then there was a polio outbreak, a small one, but from a World Health Organization perspective in November, December, I think there were, any outbreak of polio is alarming, but I think there were 2 reported cases of paralysis. So all that goes into this mix of this horrific unfolding tragedy that's upended like tens of millions of people's lives directly, and indirectly, it's already a pan-European event. Yeah. And so we're not even trying to plan beyond the next 3 months, because I don't think anyone knows what's going to happen. But
how could you? And everything has shifted so quickly. I mean, 2 years ago, the world had shifted posture to handle this pandemic. I think when we first set up this conversation, we were probably going to spend most of the time talking about how direct relief worked with countries on pandemic-related aid. So how did that go?
Yeah, I think with COVID, I think we happened to have we manufacture our own PPE and N95s that were approved several years ago. And it was really for wildfires in California, because you get these wildfires that give people with any compromised breathing, they're high risk, and they're always encouraged to get N95s. And then you can't get them, or people have jacked up the prices. So we thought, we're going to make our own and get NIOSH approval. We just got them with the valve on it, because it's a little easier to breathe. So they weren't optimal for a healthcare setting, but we had a lot of them. So that kicked us into gear. We worked closely with 3M as part of their charitable efforts. So we were able to mobilize several hundred million pieces of PPE in the US and Africa and also in Latin America. But I think it was really the two tracks, like COVID, like any emergency, it makes all the pre-existing problems worse. And it brings on a whole new set of problems in addition. So, you have to kind of, deal with both. So the COVID, we were able to provide PPE, lend our cold chain capabilities to US jurisdictions, state of California, and also the government of Mexico for their importation of vaccines. They asked for some help in that regard. We've been happy to do that. But then a lot of it was just, as so much money was being diverted to COVID, I think it was leaving, the unmanaged, the things that we already knew were a problem. So we were trying to do the best we could to keep the flow of support, including financial support, because we received good financial support that we were able to provide for things like community health, nonprofit community health centers in the US, and then focus on actually the COVID vaccine. The government did some, but they contracted out to privatize the effort, and with the government as payer, not doer. But I think it was a very, very high-paced last 2 years. And I think we were just getting in the point of consolidating. How does it look post-COVID, as we're kind of seeing the light at the end of the tunnel? And here comes Ukraine, that is just another tunnel we're right at the beginning of. But there's this limited capacity for the healthcare delivery system in the world, in every country. And so it gets upset by an unforeseen event or an emergency. And COVID was a huge example of that. Ukraine may be another one right in its heels, and combine all the compounding factors that COVID caused. It's even worse now. So it's a very kind of tough to kind of see the way forward. But, I'm hopeful that with all the things we have learned kind of as a society over the past 2 years, and the rapid development of products, and just how the workarounds that had to be done to bring in a whole new level of cold chain, at least in the US and many other places, an ultra low temperature cold chain. Those are all really good things. Those will have sustained value. Mm-hmm. The financing of it at the public level, at the private individual level, if inflation kicks in, I think you people in business and your members, Dan, that have to be really good at business, not just good at their industry. Your sense of those issues would be far better than mine, but obviously a concern for all of us.
You've mentioned, Thomas, the cold chain a number of times in our conversation. And, I think many people might have the image of cardboard boxes of medicines just being airlifted into hot spots around the world, but it doesn't work for things like vaccines or other medications that need to be kept at a certain temperature. How has Direct Relief built out this capacity and ability to deliver through a cold chain environment?
Well, we recognized, several years ago that, many of the new therapies being developed, far more than half, we're going to require a cold chain. Medicine gets individualized, mm-hmm. and the biologics and biosimilars, many of them require cold storage from the point of manufacture to the point of dispensing, or so we recognize that. And it took us about 3 years. We built a new accredited distribution center for Direct Relief itself, so we could store. It's about 150,000 square feet, and we built about a 4,000 square foot high racked palletized 2 to 8 cold room. And as COVID evolved, the state of California asked us if we could backstop it, because they didn't have it. States aren't really doers as much as regulators and payers, but for emergencies, they tend to be doers, which is another podcast. Mm-hmm. But I think, so as we built another 8,000 square foot high rack, cold chain capacity, we now have about 1,000 pallet spaces for 2 to 8 degree storage. We have -70, -20. And that's great that we have a distribution hub capacity that's the largest public benefit one in the US right now. But that's not the point. The point is to get it to the patient. So in Tanzania, for example, where we're working, and Teva has been part of this with the leading pediatric oncologist in the United States, and some of the efforts around the 8 countries of Africa to get a diagnostic and referral and treatment network into Africa for the childhood cancers. A big stumbling block was the access to the drugs, which Teva stepped up to do. But then the practical reality was that the airport in Dar es Salaam and didn't have adequate refrigeration. We can get it there in a 5-day cold shipper with a data logger, so we know what the temperature has been. But then you've got to get it through customs. You've got to get to not just the airport. You've got to get to the treatment site. So we end up just building out and paying and helping understand. Here's the technology. Here's the refrigeration. You can run it on solar in much of Africa, but it gets very technical. But I think it's something we're trying to lean into just broadly, because it's a hard stop barrier for just access to therapy. I mean, your members have brought the, true to your name, the accessibility issue based on price. It's a fundamental shift in what it was, right?
Sure.
But the access from a practical barrier through cold chain, it remains a really big one for the world. So we see it because we're trying to get it to the patient, and getting it close doesn't count. Yeah. So that's something we'll be leaning into as much as we can with the philanthropic resources, knowing that if we can help build out cold chain in any of the places that are just stretched financially and have a lower state of development of their health system, that will have a broader benefit over time than just providing the drug itself and calling it good.
So obviously we're in the pharmaceutical business, and we typically think of emergency relief in the terms of medicines and getting medications to patients. And our members, as I've mentioned, are very proud to support Direct Relief's efforts through contributing medicines to your organization. But during the specific situation in Ukraine, what have been some of the contributions that some of our members have made to Direct Relief?
Well, yeah, they've been terrifically responsive. Teva, Apotex, Agenta, and AmerisourceBergen with both antibiotics and wound care items that were urgently needed. Teva's contribution of dozens of pallets of specifically requested identified items arrived just very recently. And we're so thankful for the largesse, the responsiveness that Teva and Apotex and Agenta have kind of expressed, as well as AmerisourceBergen. They don't have to do this. It's not their job. That they did it means a lot. It means a lot for people in Ukraine.
Well, it comes through, Thomas, and how you speak about the work that you and all of your colleagues at Direct Relief do. And I've said it a number of times, but we are very proud to be associated with you and have Direct Relief as an associate member in our organization, and to make those connections between the manufacturers who make the medicines that the people all around the world need, and that this partnership is working well. So I hope we can maintain it for many years to come. So thank you for joining me on All Access today. And thanks everybody for listening, and we'll see you next time.